From the News Channel 5 Network, this is OpenLine.
Hello everyone, welcome to OpenLine. I am Ben Hall. Good show tonight. We are talking about what people have been talking about for the last, well, I was going to say week, but it's really much, much longer than that. We're talking about health care. Of course, health care reform was up in the U.S. House last week. It did not pass. So my question is, where does that leave us? President Trump came here, said some things about where we stand in Tennessee. Where are we as far as the American, or I guess what has been called Obamacare? Where are we? That's what we're going to talk about tonight. Happy to have with us two people who can answer this question. Mary Moore, Program Coordinator, Certified Navigator for Get Covered Tennessee. Thank you for being with us again.
Thank you for having us.
And Sharon Barker, Lead Certified Navigator for Get Covered Tennessee. Thank you for being here.
Thank you.
So a week ago, what were you all doing? I mean, it was kind of, you didn't know what was going to happen, right? Kind of walk us through what was going on.
Well, I mean, we were watching the news like everyone else, anxiously, especially on Thursday and then again on Friday by the hour, updating, watching C-SPAN.
Seeing how that vote was going to go.
Yes,
right?
Yeah, anxiously awaiting, so.
And the vote, it did not pass. So where does
they
that?
didn't even have the vote.
They didn't have the vote. They didn't have the votes to even have the vote, so it doesn't pass. Where does that leave us now? So where are we right now?
Right now, we're in the same place that we've been. The Affordable Care Act is still the law of the land for the foreseeable future, as Speaker Ryan said on Friday. So everything with the Affordable Care Act is the same right now. So if you have coverage on the marketplace, your coverage is intact. Everything's the same.
Yeah.
Open enrollment is on for November 1st. For 2018, as usual. So right now, everything's pretty much the same.
Business
And
as usual.
what about, so President Trump came here to Tennessee and he said something like half the state doesn't have coverage. He used Tennessee as an example for how Obamacare, the Affordable Care Act, is not going well.
Right.
I guess walk us through a little bit there. What was right, what was wrong about what he was saying? And you can take that.
Well, half the state, that's not true.
Okay.
Okay. Everybody has coverage. We have insurers in all parts of the state. Maybe East Tennessee has one insurer, but all parts of the state have insurers. And so that wasn't accurate.
So no matter where you are in Tennessee, you can get coverage through the Affordable Care Act.
Yes.
Right now. So right now it's not open enrollment, so you do have to have a special enrollment period, which we can go over those in more detail to sign up. But as of right now, there are carriers in all regions.
All regions.
It's just that in East Tennessee, there's about 16 counties where there's only one carrier. That's Humana, and they've announced that they will not be in the marketplace for 2018. So as of right now, we don't know what insurers are going to be in the marketplace for Tennessee for 2018. And so there's kind of a question mark there on those counties. So that is an issue. Tennessee has had, some exits of carriers in the last few years. So last year we had United Healthcare that left, and then Blue Cross and Blue Shield used to cover the entire state, and they pulled out of some major areas. And we've seen this with some other states that haven't expanded Medicaid, that they've lost some carriers, and that's really has to do with the risk pool and with Tennesseans who signed up through the marketplace being a little sicker than the insurance companies anticipated, and then therefore more expensive. So while we had some of the lowest premiums the first year of the Affordable Care Act marketplace, maybe those premiums were a little too low. They didn't quite match the health needs of the consumers.
Right.
So where do we go from here? All right, if 16 counties are going to be without coverage, without an insurer in next year, so where do we go? Can that be fixed?
Yes. So every year we've seen changes in which insurance companies are offering plans on the marketplace. They come in and out of different regions. So we're very hopeful that either one of the insurers that's currently offering plans in Tennessee will take over that area, or maybe even a new insurance company will come into the market.
Sure.
We just really don't know yet. Insurance companies have until June to kind of put together their proposals for their plans to offer on the marketplace in Tennessee and their plan prices to submit those to CMS. So right now we're just kind of waiting to see what will happen with that.
Has this happened anywhere else? What if no insurer comes forward? Are there places in other parts of the country where there is just no one offering insurance?
No.
And can that stand? Would somebody have to offer insurance in those counties, or could it Could there just not be? I mean, how does that work?
It's definitely a dilemma, and it's something that we haven't seen, fortunately so far. So there are other parts of the country where there's only one insurer, but at last open enrollment period, there was a carrier in every single county in the United States. So
we really wouldn't know what that would look like if that happened, because it hasn't happened anywhere. So it's just hard to say what would happen. So
then the question becomes, what needs to happen, to prevent that from happening? And I guess in the backdrop there's still this effort, I feel like, to repeal and replace. I mean, there still is this push, even though President Trump said he wants to move on. There are a whole bunch of people up there in Congress who are wanting to change this law. They don't seem interested in improving it or reforming it. It's more about repealing it. Is that your sense, or what do you get there?
It's hard to say. Even though the Affordable Care Act wasn't repealed, so the law still stands, there are some things that can be changed just through regulation with the Department of Health and Human Services, which is now under Secretary Tom Price. So we might see some slight changes, nothing substantial, like, for example, the essential health benefits that they talked about repealing with this last bill. Those are still standing. But there might be some things, like they've proposed to shorten the open enrollment period for next year. So instead of November 1st through January 31st, it would be November 1st through December 15th. And they've talked about tightening up special enrollment periods. So making it a little bit more difficult to sign up outside of open enrollment, and things like that. So we might see some slight changes, on the regulatory side, but as far as like another effort to repeal, we really don't know.
No.
You don't know?
No, and he seems to be willing to just move on. So we're hoping that he just leaves it,
So it's confusing for me. I'm sure it's confusing for a lot of people. What are you hearing from people when they call in with questions or when they enroll? What are you hearing from people?
Well, really, they just want to know, is it going to survive? Am I going to be able to have it next year? And we really can't speak to what's going to happen in the future. So we just really try to encourage people to get it. If you need it now and you're eligible for a special enrollment period at this point, let's just go ahead and enroll. Deal with your health issues now. We don't know what it's going to look like in the future, but as it stands now, you can get it, let's get it, and deal with whatever happens later.
Do you think there are people that don't realize they benefit from the Affordable Care Act and they call for it to be repealed?
I do. I think so many people didn't understand that a lot of the Medicaid expansion was a part of the Affordable Care Act, and so I don't think that they really thought that they were getting the Affordable Care Act when they were actually getting, Medicaid expansion benefits from a Medicaid expansion. And I think that some of those people thought that, oh, well, they're not talking about me because I don't have Obamacare. But the Medicaid expansion was a part of the Affordable Care Act, and I think they didn't make the connection.
Have you seen that?
Yeah, I think that there's even people who may not be on Medicaid or have a marketplace plan who benefit from the Affordable Care Act. Like the essential health benefits are a really great example of that, saying that every insurance plan has to, have these certain benefits. So I think there's, a lot of people who have benefited from it, and then there's Medicare recipients. So part of the Affordable Care Act is to close the Part D prescription drug donut hole by 2020. So fortunately, because the law is standing, that's still underway. That helps a lot of Medicare recipients.
And you still had people that didn't know that the Affordable Care Act and Obamacare were the same thing.
Now, do you really have that?
I still think you do have people that get confused with that.
Anecdotally, I've heard that, but have you heard that? People are like, I like the Affordable Care Act, I hate Obamacare, and they don't realize
they've said that probably since the beginning.
So
and I still think there are some people that still kick that around. That could be just for sport, but.
But right now, it is still the law.
It is the law.
Now, when President Trump came in, he signed some executive orders, and I thought he did some things that further kind of took the law back. Is that true? Or has it been weakened in any way since he came in, or is that not the case?
It's hard to say. I mean, the executive order was kind of broad and just gave like government agencies more power to make some regulatory changes, like we were talking about, without having to go through Congress to change certain aspects. So, I mean, there's a whole list of things that could possibly entail, but so far, you know, we've seen some things like CMS has issued a proposed rule for market stabilization. And that includes the things I was mentioning, like shortening the open enrollment period and tightening up the special enrollment periods. We don't know if that's going to be approved or not yet, but I think, you know, there's a little more power to do some regulatory things as a result of that executive order, but nothing dramatic that would be tantamount to repealing the law or taking, you know, ending the coverage or anything like that.
I want to take a break and then come back and talk about what reforms could be done to really improve it. I mean, if everyone were of a like mind up at the Capitol and they really wanted to improve it, are there some things that could be done? So that's a big question. Think about that.
The big question.
And if you want to call in with a question you may have, do you wonder if you are covered? Do you wonder how you can get coverage? This is a great opportunity for you to call in with any question about your coverage, your health care coverage. Take a break. I'll be back right after this.